Brought to you by GTA, your island, your network.
The Speaker's bill was vetoed by the governor last March, and it was only on Monday that the legislature mustered 11 votes for an override. Lawmakers are seeking any way they can to blunt the impact of a mounting $70 million revenue shortfall.
If the negotiating team had just sent up what they considered to be the most economical health plan, then we would save $20 million.
Jerry Crisostomo of NetCare Insurance, which holds about 5% of the market, says it may make sense to go with a single exclusive carrier given the looming financial crisis.
The governor said the cheapest doesn't always mean the best, but you could, again, as a governor of Guam, set your own requirements under your RFP of what you want in your group health plan, and it'll be up to the bidders to perform.
The Speaker cites figures from the negotiating team indicating GovGuam could have saved more than $50 million over the last several years. But Frank Campillo, the administrator of Calvo Select Care, which holds about 80% of the GovGuam market, says those numbers just don't add up.
We know the claims, and we know that anything below or close to those numbers that are being stated would have been very difficult for any carrier to be able to meet the financial responsibilities of that.
Another requirement of the new law is that covered plan benefits remain the same. Campillo says a better option would have been if the government just set a cap on what it plans to spend.
This is all we're going to pay for a single, this is all we're going to pay for a couple, and this is all we're going to pay for a family, and then still give the employees the options to choose health insurance.
He says starting a price war could backfire. It could lead to patients losing access to preferred providers and to unrealistically low bids, which he says would be irresponsible to accept if it threatens the solvency of the winning contractor.
The federal government, for instance, when you submit a proposal to them, and if your premiums are too low, they actually come back to you through their actuarial team and tells you, look, your premiums are too low, we won't let you bid on these premiums, you got to change your premium.
Negotiations for the government's next health insurance contract get underway in a few short weeks. For Guam's News Network, I'm Nestor Lecanto.
Brought to you by GTA, your island, your network.